Hello, everyone. This is Dr. Kim. Welcome to my radiology channel. And in today's video, I'm going to show you two scans that are taken 3 months apart from each other, which will demonstrate progression of bone remodeling after extraction. And also, this is a great example of direct sinus lift. Okay, so the scan that you're currently seeing is the later scan that was taken 3 months from the initial scan. And what I want you to see is this beautiful post-surgical outcome from a prior sinus lift procedure. Let me go ahead and adjust the scan just a little bit. And look at this axial view, coronal view right here. What you're seeing is this heterogeneous material along the floor of the right and left maxillary sinus is indeed the graft material. I'm really impressed by not only the amount of graft this the surgeon has placed, which is more than plenty for what this patient is needed. And I guess that's a good thing. It's better to have a little extra than not having enough or adequate amount of graft material. But also the way this graft has integrated to the underlying ridge is very, very good. And I say that because I don't see any radiolucent line separating to a region of areas, right? So this is a graft and this is the underlying bone. The fact that they're literally blending to one another, that's kind of what I'm looking for when assessing successful outcome of grafting procedure. So that's really, really impressive. Whoever did this procedure should be recognized. I have seen some other sinus lift procedure where provider did not place enough or adequate amount of graft, or sometimes due to significant inflammation, it failed to integrate with the surrounding bone. But in this case, that's not the case. The remainder of the sinus, so this is the new floor of the right maxillary sinus, is clear, right? The sinus itself is clear, well aerated. I don't see any evidence of significant mucosal thickening. Perhaps we could argue that there's a trace mucosal thickening, which is normal that we see in many of our patients. But again, if you look at the left side, there's tremendous amount of graft material that has osseointegrated well with the surrounding bone. That's very impressive. Let's see how long this implant is. It's measuring about roughly 11 millimeter, but we have another 4 or 5 millimeters to go, basically. So I think it was possible if the provider wanted, they could have put in even longer implants. In addition to sinus lift procedure that you see bilaterally, we also have some graft material placed along the buccal of the anterior maxilla. Buccal to the anterior maxilla. So right here, okay, buccal to these 4 implants. And we'll take a look at that from the sagittal view. Starting from the area of canine, as we go across, what we see is area where it's blending, but also a radiolucent line potentially separating or potentially indicating incomplete remodeling of the graft. And that tends to be very common, especially the buccal graft. Like it's relatively uncommon to see where the entire area of the graft is fully integrated with the residual or underlying bone. But rather, in most cases, I see partial integration and on other areas that hasn't been fully integrated. So looking at this particular scan, I feel that it has a very good osseointegration on the left side of the ridge. I mean, that's very good. It's pretty much as good as you can get with buccal graft uh, material or lateral ridge augmentation procedure. I think that's a little more formal way of saying it. But then if we go over to the left side, this area looks pretty good, but right about here, I wonder what's exactly underneath this graft material. It may just haven't been fully calcified as of yet. That looks, again, normal, but fully integrated, but perhaps not necessarily over here. So, but overall, I think this is a successful outcome, and you can't expect too much better result than this one. Now, I want you to compare this to a scan that was taken 3 months before. So let me go ahead and bring that scan over to this area. As far as a sinus lift procedure that you see on the right and left, it should be similar. But the area of concern was that this area, which is approximately the site of missing number 31. Okay, so we have 27, 28, 29. This is 30. This is 31. At the side of 30, we have 2 screws, metallic screws, fixating buccal graft, right? And what do we see? For the most part, I see a radiolucent line separating the graft from the underlying ridge, pretty much throughout the graft. Okay, we see that here. We see it here, and let me go posteriorly. We see here as well. So compared to the outcome that we saw in the maxilla, this isn't an ideal outcome, right? It doesn't mean that it hasn't, it's freely loose graft. It's possible, I guess, but I don't know exactly, because again, if you look at this axial plane, let me adjust the contrast a little bit. I see areas where it's blending into the underlying ridge, whereas some areas, definitely there's a radiolucent line separating the 2 areas. So I didn't think it was quite ready to receive an implant. Not only that, if you look at this extraction site, number 31, it's mostly radiolucent, right? For whatever the reason, it hasn't fully calcified, or the woven bone has not been fully calcified, and I see some amount of graft material along the alveolar crest. So again, it's not clear to me why the clinician did not fill this area with graft material, but only along the buccal side. But either way, I think radiographically, we all agree that it's not quite ready to receive an implant. So now fast forward once again to this one, 3 months later, and let's see how much it has improved or remodeled since then. So again, where we have this implants, the screws represents the area of 30. And why don't we look at area of 31 first? Because that was very clear that the socket has not been remodeled. Whoop, excuse me. Okay. All right, so what do we see now? After 3 months, what we see is, thankfully for the patient, we see a lot more calcified woven bone, right? That's looking a lot better than what we saw previously. Let me bring that over here like this, right? That's a lot more radiolucent. So that's good. It has healed, and I'm sure it's continued to remodel, and that looks really, really good. And now what about the buccal graft material? We still see some areas of perhaps incomplete osseointegration, but again, looking much better. The radiolucent line is not, throughout the entire grafted site, but rather I see more areas where they're literally in contact with one another. And here as well, that's an improvement. Even as you look at the coronal view, yes, we see that radiolucent line again, but even the width of this line or the thickness of the line has decreased compared to the previous scan. So overall, it is moving in the right direction rather than the other direction where the graft, is failing to integrate. So while this outcome, once again, may not be ideal, as nice as we would like, but it's still moving in the right direction. And I think sooner or later, this site should be ready to receive an implant. So my guess is that the clinician will be placing an implant right here. So the new ridge would be now, presuming this graft will integrate successfully, it went from 7.5 millimeter ridge to 11.5, right? So just that really changes the type of implants that you can place. So that's really good for our patients. Anyway, that's all I wanted to talk about in this video. Thank you very much for your attention, and I'll see you in the next video. If you like the video, always be sure to click the like button. And if you don't mind, or if you continue to listen to these types of videos, be sure to subscribe. Thank you very much, and take care, everyone.